The fishbone diagram, or the cause and effect diagram, is a tool that helps us identify and organize potential contributing factors to our problem. If you look at the diagram, you can see that it has a fish head, which is the main problem we're focusing on, and the bones branching out other causes that led to the problem. In this case scenario, the fish head, or the main problem, is the medication error, insulin overdose, and it has led to hypoglycemia of the patient. And the fish bones or the contributing factors include process, environment, system, and people. And let's break it down. So first we have process. So this includes factors such as informal second witness practice on the floor. Nurses like Mike are treating the witnessing process as an extra step instead of an essential safety step for high alert medication administration. And there's no clear process for insulin dose verification either. So the dose is simply verified through a sign off, which creates room for shortcuts. And then we have environment. So this includes things like being on a busy, time pressure floor. Nurses are rushing to complete their tasks and usually have little time for a proper verification process. Understaffing can also be a problem since Mike is rushing to get everything done, showing the floor may lack support and resources. The atmosphere and the culture in this unit may also be a contributing factor, considering Sarah was afraid of not getting along and was discouraged from asking questions or speaking up. Then we have system. So this includes lack of access to patient information. If Sarah were able to get a quick look at the patient's record to double check the patient's blood sugar and compare it to the sliding scale, she might have been able to ask Mike if the dosage were, for example, like 8 units. And Mike might then have realized he made an error. There was no detailed verification documentation that asks Mike and Sarah about how many units and the patient's current blood sugar for high alert medications such as insulin. Lack of ongoing training or training on how to solve these conflicts is also a contributing factor, which led to Sarah having problems questioning Mike. Then we have people, so this includes both nurses involved in this incident. First, we have Sarah, who lacks the confidence and courage to speak up and question Mike's unsafe medication administration process. She relied on trusting Mike and his years of being an experienced nurse. Second, we have Mike, who skipped the basic 5 rides on medication administration due to being rushed. When Sarah, the new grad RN, asked him a general question that related to patient safety, he refused to answer and failed to create a supportive environment that promotes safety.